Hello and welcome to this session. I'm your moderator, Claudia Schwarz, and I'm happy to present you the speaker of this session, Scott Bernstein, who will be talking about the regulation project he's involved in. Scott is Director of Policy with the Canadian Drug Policy Coalition, where he leads the organization's work on legal regulation of drugs, decriminalization, and international drug policy. He's also heading the MAPS Canada Drug Policy Committee. In his previous work as a lawyer, he focused on advancing the human rights of people who use drugs. And he also served as a program officer with the Global Drug Policy Program of Open Society Foundations in New York. In his presentation, Scott will talk about the Regulation Project, an international initiative that seeks to create new frameworks for regulated legalization of psychedelics and other drugs. The project aims to correct the problems of equity, health, safety, and sustainability that are created by the current prohibition framework. The Regulation Project engages in a broad variety of heterogeneous stakeholders, including public health professionals, drug consumers, government, youth, and media, in a discussion about different regulatory models. As someone who has worked with creative methods for engaging the public on issues of science and technology, I'm particularly interested and look forward to how Scott and his colleagues are using innovative tools such as board games to stimulate drug policy reform discussions with members of the public. So it would be great to get Scott on stage, and he will give us a 30-minute presentation, and afterwards we can ask him questions and he will answer. So don't forget to write your questions in the Ask a Question section. Hi, Scott.
Hi, Claudia. Thanks for the nice intro. And hi, everybody. This is, not how I was imagining doing this talk and workshop several months ago, but I think it's a testament to all of our resilience and excitement about the issues. And I'm really thankful that this conference is going ahead and I get to be a part of it. So are you hearing me okay, Claudia? Great. As Claudia mentioned, I'm going to talk a bit about legal regulation, which is one of the big areas of work we're engaging in my organization, the Canadian Drug Policy Coalition. And my talk will be a little bit of sort of a lot of just the rationale of like why we need to be thinking about legal regulation of all drugs, and a bit of like why we need to be thinking about it now. And then sort of go into some of the mechanics of what kinds of things we need to think about. And then, as Claudia mentioned, a lot of what our work we arrive to is really around public engagement, and it's part education and part getting feedback from the public on what kinds of systems of legal regulation they would like to see in a variety of stakeholders. So so I'm going to go out on a bit of a risky adventure here and try to share slides and images, because later on I'll be talking about some of the methods we're using to engage the public, and a lot of those are visual. And so I think, I was sort of thinking like, how could I describe what a board game looks like? And it's not, and I decided I couldn't. So hopefully we go without some technical problems, because I'm going to be trying to switch back and forth a bit. And so I'd like to acknowledge that my work is done in Vancouver in Canada, and it's done on the unceded traditional territories of the Coast Salish people, the Musqueam, Squamish, and Tsleil-Waututh First Nations. And a lot of that fact is one of the strongest motivators for why I think we need to rethink drug policy and reform, because a lot of the harms of drug prohibition have really fallen on the shoulders of Indigenous populations, and sort of the downside of colonialism, which that's something I like to acknowledge, and we do that a bit traditionally in Canada to recognize where we're working and how that informs our work. Okay, so getting into the content, so I want to start out and just say, like, if we pause for a moment, in the last several years we've had some really amazing drug policy developments, and so one which I think you're really well aware about are the decriminalization of psychedelics in entheogenic plants and fungi in several jurisdictions. So we have successful efforts: Oakland, Denver, Santa Cruz, and then dozens of initiatives in the works in the U.S. and in Canada. We also have, which I think you're also well aware, is now medical studies around getting access to psychedelics for all kinds of medical issues. And so we have ongoing research trials and breakthrough therapy status for MDMA. We also have, over the last several years, permission has been granted to access psychedelics for religious purposes. In Canada, we have something called Safe Supply now, and this was a response to COVID, but it's something we've been advocating for many years, which is basically access to all drugs, opioids, stimulants, benzodiazepines, to people who need them in replacing the illegal drug supply. So that was just initiated a few weeks ago in British Columbia, where people can now go to a prescriber. Basically, if you're at risk of COVID and you are dependent on drugs, they will give you up to a 23-day supply of stimulants or opioids or benzos to take home. Going down the list, other developments, we have legal regulation of cannabis for non-medical use in the US and Canada. We're starting to have discussions more about decriminalizing all drugs as a response. And I'm sure there are other things I just didn't capture in that list there, but I just want to say, like, these are all, of course, good developments, but my argument is that they don't really go far enough. And so sometimes they're time limited. For example, the Safe Supply Initiative has a cap in September, and so we're concerned that people having access to legal drugs will be cut off. They're also oftentimes they're limited to a certain group of people who are eligible to access the drugs. There's some drug exceptionalism going on where we're decriminalizing some things, but not other drugs that maybe have the most social and individual problems. And then finally, my big issue is that decriminalization doesn't deal with the entirety of the supply chain. And so it largely deals with the consumer end of taking drugs. So it's the possession of drugs that's allowed, sometimes some production, but largely it's not creating a full set of rules around the supply chain. And when we have a problem of overdose crisis in North America, which is largely attributed to a poison drug supply, decriminalization helps, but it doesn't address the root problem of that. So legal regulation, I think it can be another solution. It should be something we're thinking about and considering. And let me start out by just saying, what is legal regulation? So it's I define it as a government set rules over the full range of supply and consumption in the supply consumption chain. And so when I say government set rules, it doesn't necessarily mean government or business or anybody else must run aspects of it. So it doesn't mean government is necessarily running supply or running distribution. It could be just that the government is setting the rules and setting how oversight will happen, for example. So it could be private business models, could be government-run sales distribution, it could be nonprofit, could be something like a compassion club or a social club, or it could be a mix where the government takes care of supply and private enterprise takes care of distribution, and compassion clubs take care of retail, for example. So whatever happens, though, when we think about legal regulation, and I'm going to try my first slide here. When we think of regulation, we actually have a set of levers, and so regulatory levers that can be useful for deciding what's in a legal market. So, okay, there you go. So hopefully you're seeing this. So there are Mark Hayden, who's a drug policy researcher up in Canada in Vancouver. He made a big spreadsheet and identified over 120 regulatory levers that could be used. And so they fall into different categories. And so the levers go everything from, like, what does the packaging look like? What age do you have to be to get it? What kinds of things do you have to have for retail? What do you have to, where can you consume? What does that look like? What kinds of education? As well as things like who gets a license to produce, what conditions they have to do it. So it's really covers the full spectrum of how we would want to control a drug market. And so there are many of them. They fall into these three categories. And I just want to say, like, if we start thinking about legal regulation, so actually, like, drugs or what we think of as the illegal drug market is the exception to how our state, our government actually approaches things that have risk. So those are risky activities or things. So if you think about, like, alcohol, tobacco, food, mining, forestry, gambling, financial investing, health services, transportation, and even pharmaceutical drugs, all of those things have potential risk to them. And instead of just leaving those things alone to an unregulated market to deal with, the government has actually stepped in and said, we can control some aspects of it to make it safer. And so the drugs, I'd say, are the exception, where we largely have just blanketed, prohibited it, the access to many drugs. And so what we have is often illegal, unregulated actors in the market who are taking responsibility for how it's shaped, and that's largely a result of why we have these problems that show up. And so I think, as we know, many currently illegal drugs, including cannabis, coca, opium, psychedelics, have been used for thousands of years for spiritual, medical reasons. And in modern time, even up to the early 1910s, diacetylmorphine, which is actually the chemical name of a brand product made by the Bayer company called heroin. That was legal and available. Cocaine, cannabis also were popularly used and available without prescription. And so let me try one more slide here. Sorry, it's not letting me just flip through them easily. There we go. So a lot of these, we can see there's traditional use. There's actually some, mushrooms in mythology. There's products. These up in the top right, there's certain cannabis products and extracts. Cocaine was a toothache medicine. And in the middle left is heroin hydrochloride, which was originally introduced as a cough remedy. So all of these were legally available to people for many, 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 many years, and it wasn't until recently that prohibition took over. And so that's that's sort of where we are, where we've seen a gradual ramping up of prohibition. And so why legal regulation, right? And I think we know drug prohibition. Probably everyone at this conference is going to agree that it's bad. It's a public health problem. We have over 770,000 overdose deaths in the U.S. since 1999. In Canada, we had over 14,000 deaths in the last 3 years from overdose. We have HIV, Hep C transmission, marginalization, and largely that is attributed to a poisoned drug supply. We have social justice equity issues around over-policing and incarceration of racialized and indigenous people. We have exploitation of indigenous communities we have public safety issues, organized crime, violence. We have economic issues. We spend a huge amount of money, billions, for arresting, policing, taking, bringing people to the criminal justice system, putting them in prison for drug use. And also there's the downside. We don't have any tax revenue from illegal actors who don't pay taxes. So that's one, not saying that that's a reason to do it, but we're spending money and we're not getting anything back that could get back. We also have environmental damage through use of pesticide, toxic chemicals in drug production, deforestation, and then ultimately, like, individuals have loss of liberties and freedoms. We don't get to decide what we do with our bodies. We also have criminal record problems if we've been convicted, problems getting employment or student loans. So in short, I think there's like a growing recognition, at least in North America, that the war on drugs is a colossal failure. That's also true in other parts of the world. They're starting to recognize this. So with all these problems, why haven't we legalized drugs already? So I think thinking about it, I think that's really attributed to a couple of factors. One, discourse around legalization is limited because drug policy as an issue is stigmatized, right? So even drug use is stigmatized, but also just talking about drug policy reform is often an issue that people don't feel comfortable talking about. There are a lot of myths about drug use and what legal regulation would mean. Does it mean that there's going to be heroin in a bulk bin in the 7-Eleven? Or maybe not. Probably not. And then there's also, things like fears about new public health challenges. Will it increase dependency on drugs? It's politicized. Up in Canada, it was basically, Justin Trudeau, the prime minister, was accused of being a dirty legalizer, wanting to legalize all drugs, even though he didn't. And I also think, like, one of the biggest issues is it's a complex issue. It's like climate change. Where do you begin? Is it about alternative energy sources? Is it about species? Is it about global warming? Like what do we, where do we begin with such a complex issue? And so it's often difficult to just get people to wrap their minds around it. And then finally, I think the reason is it's morally charged. Another reason is that it's not being discussed is it's morally charged. People feel that it's wrong, and so they're not open to considering it. And so in response to this situation, we started an initiative called the Regulation Project, and that started in, trying to share the screen again. Here we go. Oh, saw that one. Let's keep going. Saw that one. There we go. So we started an initiative called the Regulation Project, and there's the website for it. So feel free to check it out, regulationproject.org. We were formed in 2017 as a collaboration of 6 Canadian organizations wanting to move the conversation on legal regulation forward in Canada. Currently, there are 11 organizations from the UK, Canada, the US, and Mexico, and we're growing as a network. My organization, Canadian Drug Policy Coalition, coordinates it. The broad purpose of the group is to develop, share resources and ideas, collaborate on advocacy and education programs. Things like webinars, online engagement during the COVID time are being cooked up. And then ultimately create strategies to move the conversations about legal regulation forward in our own countries and elsewhere. So early on, this group recognized the need for, particularly the Canadian organizations involved, recognized the need for a Canadian blueprint So basically, what would regulation look like for us? Like the devil is in the detail. So, is the heroin in the 7-Eleven? Is it in a doctor's office? Is it somewhere else? Where can you consume it? And so we started out this project here by doing a lot of research on what's been written about legal regulation by academics and advocates. So what we found was there was lots of discussion on the rationale for regulation, much less on how to specifically regulate. But those that were there were pretty good. Like they were very sound cases around that. And I'd recommend, if you haven't looked at it, Mark Hayden, Bruce Emerson, and I believe Ken Tupper were the authors of a paper around how to regulate legalized psychedelics that is out there. So it's a good idea, but we found that there was very little academic discussion about public perceptions on legal regulation, or this other important fact, what does it mean to have consumer buy-in, and how does that relate to the success of legal regulation? And so, if we look at cannabis legalization in Canada, one of the reasons it's struggling is that to date is that it's largely informed from an academic and government perspective, the market is, without enough input on how people actually want to purchase and consume cannabis and what kind of market it is. So in our opinion, public health-based models that were recommended for legalization of all drugs didn't adequately address the public part of a legal regulated market. They need to talk to more people who actually consume the drugs. And so I'm seeing in the comments that people want the paper and the authors again, and I'll try to dig that up again. It's Mark Hayden, Bruce Emerson, and Ken Tupper, I believe, are the three authors. And yes, thank you, Vilmarie. Okay, so in the chat window, she posted it. So when we started to think about legal regulation, we realized there had to be some important principles that we needed to follow. So it had to be grounded in public health principles, including furthering human rights, individual well-being, equity, social justice. It has to acknowledge non-medical drug use. We have to abandon abstinence-centered policies. And ultimately, it has to create a flexible and multifaceted market that encourages less risky choices. So that would have to do with which drug is preferred, what form, and how it's taken, recognizing that not everybody's going to go there, but it's you're not mandating people use certain drugs in certain forms, because that we know that doesn't work. But to actually create market levers, like we talked about, that drive people towards taking things that are less risky. And so it ultimately has to support 6 principles: economic justice, health justice, racial justice, gender justice, environmental justice, and trade justice, which often we're seeing that places that have legalized cannabis haven't really addressed all of these adequately or consistently. And so our determination then came to this important missing piece around consumer and other stakeholder preferences, and ultimately education. And so ultimately legal regulation is going to be a political ask. And so we have to get the public behind it. And so it was more than just polling public opinion. We really wanted to create an environment that was sort of deliberative democracy around people having part of it. And so we first felt we need to simplify a bit. So out of those 120 levers, we narrowed them down to 5, which directly related to reducing the risks of drug use. And it also were things people were really care about, like they really shape the market. So the 5 are who has access to drugs? What does somebody have to do to get access to them? Where can somebody access them? How much can they get? And then where can they consume them? So for psychedelics, for example, like people, if you think about it, if MDMA is in a medical environment, it's limited. Who has access? Well, somebody perhaps with PTSD. What do you have to do to get access? Maybe you need to have a doctor give you a referral. Where do you go? You might have to go to a clinic. How much can you get? Whatever a standard measured dose is, and you consume it there. And so if you think about something like for non-medical use, those characteristics are really going to change. And so it depends a lot on what drug we're talking about and sort of what purpose you're using them for. So we created for each, we started out by creating just 3 options for a set of drugs for sort of like liberal models to more conservative. And then we workshopped them with a few stakeholder groups to get some feedback. And what they told us was that they need to be simpler, but they need to be, and they also need to be like more open and flexible to get people to do different choices. So what we ended up doing, and this was sort of in a response to a challenge, I gave a talk about this work in Porto at the harm reduction conference last May, and some government people from the government of Quebec saw that and said, we want you to come and do a workshop at our annual public health conference in Montreal in November. The problem is it's World Cafe style, so you're going to get 15 or 20 minutes with a group of people, and then they're going to move along. And I was sort of like, how on earth are we going to talk about legal regulation in 20 minutes to get anything substantive out of it? And somebody proposed the idea, like, why don't you create a board game? And so last summer, we took our models, we revised them, and we created something called the regulation game, which is a collaborative negotiation-based role-playing board game. And so it's based on those 5 questions I talked about. Who has access? Who can get access? What do you have to do to get access? Where can you get access? How much can you get? And then where can you consume? So we flip back to some slides. I'll show you it. And right on. Okay, so this is the board. It's circular. It's usually for around 5 or 6 players max. It's showing our old logo in the middle. This was the first version of the regulation game, and so you can see the 5 questions. And within each question, there are 4 options, and then the ellipsis, the 3 dots, are leaving it open. Like maybe you have some other idea. And so, for example, who gets access to drug? It would range from anybody of legal age to up to people who might have get a license, maybe have gone through some training, or it might need a doctor's prescription, or ultimately at the far end, it's people who are dependent on substances. So, for example, if we're talking about access to heroin, it's somebody who maybe has a long-term history of opioid use. And so, and again, like each of the questions sort of goes through a spectrum from liberal to more conservative. We decided to make it a role-playing game because the reason is we wanted to try to get people to think outside of their own issues and see themselves in the perspective of somebody else for a while. So this is one of the character cards we created, and it just has some information. Like a lot of times they have information that the player has to fill in while you're playing this role, but you sort of gives you an idea of where they might stand on things. And then for each of the questions, we created a bit of a option card, which talks a bit more about what those options are, what they look like. And then it rates, you can see in the right in the colors, sort of some of the goals we want to see for legal regulation, like educate consumers or eliminate the illegal unregulated market. And it scores a bit of how well each of those choices does or doesn't meet that. And so the idea was to educate people a bit about like our assumption was like, doctors might come in and say, we want a prescriber-based model. And, okay, but that's going to eliminate a lot of people who might otherwise access it. So the downside is you're really not going to eliminate the illegal unregulated market with that option. Some of the other options might do that better. So here's the game sort of being played. The idea is that players, there's multiple rounds, like like a few, but it's really about negotiation and discussing. And so they look at, and you're also seeing in this picture, we did a little bit of a sheet about what is the drug and some of the characteristics of it. So they work with one drug at a time for now. We're working on thinking of how to do multiple drugs at the same time. You stake out your pawns where your character is, and then you start negotiating and compromising to see if there are some solutions you can come to. And we really are encouraging people to unpack a bit of like this choice, like what is it about a vending machine to access drugs that you like? Well, I like that it's 24/7. I like that it's not very big brothery. I like that I don't have to contact medical personnel every day, and so it's not stigmatizing, and I can do it on my own. And then ask people to say, well, if these are the characteristics you like about it, could they be imported into another model that somebody else likes? And so we're encouraging collaboration and negotiation around that. So we launched this at the Reform Conference in November in St. Louis with a lot of swag in the old logo. That looks a lot like Trivial Pursuit pie pieces, I think. But and then we brought it ultimately to the Public Health Conference in Montreal, including the top left. We're playing it in a bar with some students from the Canadian Students for Sensible Drug Policy group. And largely the makeup of the Montreal conference were public health clinical people, and so it was really interesting getting them to sort of like think about other perspectives, and they seemed to really enjoy it. And out of this, and out of discussions with people, we now realized there was some utility in creating other versions of the game. So we created one around decriminalization options, and then ultimately one around safe supply, which is a hot topic in Canada. And we actually it's forming a basis of a research project we're doing around how people want to see safe supply rolled out. We brought it to the Commission on Narcotic Drugs in Vienna in March. And so we are playing in the UN bar with some different groups, to the different versions of the game. And we also were in the right side of this one. Health Canada, the government of Canada, let us put up the safe supply version of the game in our booth we had there. And so, I think they weren't quite ready for the decrim or the legal regulation full version, but the safe supply game was something that they supported. Yeah, just looking. So future plans for the game. We have a grant now that it's also a Government of Canada grant we received to run focus groups around the country around models of safe supply. We've had to adjust this project because of COVID. So our researcher is going to design ways to do focus groups virtually. And so I think the idea is to really, particularly people who use drugs. So we want to sort of workshop some of these models of like, how do we supposed to access safe supply in the way, because there are a bunch of pilot projects running around Canada now, and it's a big thing, particularly because of COVID, but it's really important, I think, to get a lot of feedback and use what we learned from that as a tool to advocate with the government to have some models over other ones. We're also working to develop an online version of the regulation game to play in, and possibly the decriminalization game. And so our hope is to use this during COVID and then beyond. I think what we will do is we'll try to do something sort of quick to just keep engaging people around that. And so ultimately, our project was hoping to at some point develop an online version that would be able to engage like tens of thousands of people around Canada on legal regulation. And so I think we're trying to just rejig and see how that would work in a COVID environment.
Scott, can you wrap up so that we can move on to the question and answer?
30 seconds, Claudia. I'm in the last part. So in conclusion, I just want to say legal regulation could be closer than we think. And we need to educate people about what it means and start talking to them about what kinds of system they would like to see. And I think before I get lost and run out of time, slide one, and it's just my contact info. And so this, if you want to get in touch with me, feel free to email or tweet at me. And there are the two websites of my organization and the regulationproject.org. And we have a project team who worked on game development, research, game design, all kinds of different things. And I want to thank them for that. And really happy to answer some questions.
Thank you, Scott. Yeah, wow, amazing work you're doing. I'm really excited about it, and the creative solutions that you offer with these board games and now the online versions of it is amazing. I think there were some short questions concerning the games and whether they are already available, maybe for being downloaded and maybe for people to print the game themselves and maybe start discussions wherever they are?
Yeah, absolutely. And so one of our principles of doing this work was to keep the game completely open source. And so I can like the files can be downloaded. I'm okay with even like if we ended up printing the game board on banner vinyl, like just like a copy shop was able to just print them out for $30 or not very much. And, I'm completely okay with organizations putting their own logos on it. If they want to use it, as long as maybe like keep our logo there as well or something, but, add your logo on, that's fine. Like, so it's all open source. And if people email, I just want to track for my own interests, like who's using it, and sort of create a dialogue so we can get feedback of like what you learned and how it worked so we can continue to improve it. So if you want to email me, I can send you a link where the files are, and you can just download them and print them out. I can give you some help, instructions on that.
Mm-hmm. Great. I don't know, are you familiar with the Play-Decide games?
Somebody just told me about Roll20, which is I think what we're looking at. So that's like an online board gaming, and I can upload the board and create the materials in there. So I think that's something like that is what we're going to be using right now to engage and try to see if it works.
Yeah, great. I'm already inspired to use your game maybe when I'm back in Vienna and do some discussions. So that's amazing. Sure. Let's move to the questions. So the first one that got the most votes is about the difference between legalization in Canada and the United States. So do you see important differences here, and how do you kind of anticipate the future in terms of legalizations? And how long do you think progress will take in these both countries?
Yeah, so I think there's a bit of a different dynamic because of the federal system. Canada's a federal system as well, with the provinces and the federal government. But the big difference is that our criminal law is all federal. And so when we want to legalize drugs, there's one statute in the federal law that basically is prohibition, and ultimately the provinces are bound to follow that. In the US, you have both. Like you'll have federal, the prohibitions under federal law, and then you'll have state criminal law as well. So you almost need to do it a bit of both. And so if you look at the examples of cannabis legalization in the US versus Canada, in US it's sort of picked off state by state with changes until at some point there's a tipping point, we hope, that ultimately the federal government will go along and it will just ultimately carry it over. In Canada, it was ultimately a choice of the federal government making the decision. So I think one way to approach it, but I also think like politically in the U.S. if state of Washington or Colorado decided we want to legalize heroin and cocaine and psychedelics and create a market for it. Like it's probably not the same politically as legalizing cannabis, where, at some point it might provoke a response from the federal government. And so I really think these issues are largely political, in that a willing state that wants to create a pilot project and do it probably needs some sort of work with the federal government to help create it. And in this political climate, it's very difficult. In Canada, we're sort of beholden to the federal government to do it, but we also have provinces that are doing taking a lot of leeway using public health as an excuse. And so particularly in the West, in British Columbia, we're actually pushing the boundary around things like decriminalization and legalization through safe supply, where the rest of Canada, even though they're allowed to federally, the rest of Canada hasn't come along yet. So it's more like, getting doctors and pharmacists to buy into the program that the government of Canada said was okay to do. It's just political largely. So I think that's why I think like a lot of this advocacy has to be about hearts and minds. It's sort of, if people's fears are that heroin's going to show up in the 7-Eleven, we actually need to show them that that's not maybe the best outcome. Like there's some other model that balances how people will be willing to use a drug, and also how willing, physicians or the medical community is to support it. And so my theory is that you have a liberal model and a conservative model, and ultimately when people negotiate, they land in the middle somewhere. So yeah, what's the next question?
Mm-hmm. I would like to ask you a question that's kind of burning for me. Because I'm looking at how psychedelic researchers are viewing decriminalization and legalization efforts. And there's a group among the researchers who's kind of scared of the decriminalization. It's kind of, being a bit of a danger to their own efforts to go through the FDA regulatory systems. And so I would like to know what's your perspective on what would you suggest to the researchers? What should be their role in this whole, the bigger debate about psychedelics in particular? And do you see them as allies in your work? And how would you, like the drug researchers to position themselves?
Yeah, no, I think definitely like, academic research is great. And most of the time I'm a lawyer by training. And most of the time when I talk to researchers about being more advocates for policy advocacy, they're, I can't, I'd ruin my neutral perspective, and like, fair enough. But I think that sort of skirts the issue that doctors and researchers and the medical community and the scientific community actually has political pull, and they've used it. And I think researchers coming out and say, you don't have to say like, I really feel this strongly. You could say the evidence is showing very clearly that this is a better policy approach than this one. And this is what we should be doing. It doesn't mean you're an unbiased advocate. It's just mean you're engaging in knowledge translation, which is what in Canada, that's the term we use for basically, we're taking your scientific study and putting it into an infographic, or because people don't read scientific studies. It's sort of, how do I translate that? How do I translate that into something that's useful and easy to understand? And so I think I think the part that I'm feeling we really need to engage, though, are things like economists and things that are not people who are knowledgeable or study consumer choice and consumer behavior, because I think I think, we can learn lessons from cannabis legalization about how not to legalize other drugs. And I think we don't necessarily want to see a capitalistic market for psychedelics or for other drugs. What we want to see is a market that's really about social justice and equity. And we want to see a market that follows principles. And it doesn't mean actors can't go in there and make a living doing it. It just means that the driving factor isn't about making money. It's about creating public good and public health. And so I think researchers and doctors and science, all these people have a huge role to play in telling us exactly what happens, what is the best model to choose. And I think also consumers have a real important voice in this that's not being heard.
Mm-hmm. Thank you.
Sure.
Let's look at the question here. Or there's first a comment about limiting distribution rights to people who have licenses amplifies problems of marginalization. The question is, can we do the opposite and instead give everybody the same rights by default and deregulate what can't be done? For instance, adulteration.
Yeah, I think so. Licensing is one model of government or regulatory control over the market, and I think people, a license is a broad term that actually doesn't, it could mean you fill out a 200-page form and application to get something. It could also mean that you've just sort of agreed to learn about it, or you're sort of being educated about it. So I think there's, I don't want to take licensing off the table on the premise here. I'm not saying it's necessary, but also the idea that I really want to stress is all of these models. All of these models are flexible, and they're really about us creating the system that works for us. So if we see that marginalized populations can't get into the licensing scheme, then it doesn't. It really says okay, we have to adjust and we have to modify and figure out how to bring those people into it. Because I think if we decide that one of the core principles is creating equity around, things like producers and suppliers and distributors, and creating an open system. Another big thing is in the cannabis industry, we've learned is that there are a lot of people out there who are involved in the drug trade, and we once we legalize, we can't demonize those people and say you were an illegal actor, so you have no role in the new market. I think ultimately people who are involved in drug sales are not they necessarily have rational reasons of why they're doing it. They're not ultimately out to hurt. It's ultimately self-interest. And I think it's the role of us creating a system that actually brings in people, and I think as long as you're not engaging in violence or fraud or some other things that we might be really concerned about, you probably could have a legitimate role in a legal market. Mm-hmm. And that's part of the equity about undoing the harms of prohibition.
Thank you, Scott. Time is up, unfortunately. We would have had a lot of other interesting stuff to say, I'm sure, but I hope people will keep in touch with you. And thank you so much for your amazing work.
Oh, you're welcome, and thank you so much for the opportunity. And I really welcome people to contact me. And if you have questions about this, if your organization wants to be part of the regulation project, if you're part of an organization that's, I think that ultimately it doesn't have to be your main points. It's just we all agree that the end of the war on drugs is some kind of a legal regulated system for everything. And so reach out. And great to see you all. Enjoy the conference.
Yeah. See you. Bye.
Thank you. Thanks, Claudia.